Assalamu alaikum and welcome to the Enterprising Women's Network. My name is Dr. Najwa and I am talking to you from the heart of Silicon Valley. I'm a foot and ankle surgeon, board certified in the state of California, and I am also an entrepreneur. My career has allowed me to wear multiple different hats, and I wanted to talk to you guys, especially young aspiring physicians or female founders or entrepreneurs, of tips that I've learned on this journey. First and foremost, I wanted to tell you that having a career in medicine is a very difficult but rewarding choice for women, especially women who want to have a family and have to still be, mothers, wives, daughter-in-laws, and daughters. So in the Pakistani culture, which I am Pakistani, one of the things that makes it difficult is that regardless of if you have a professional career, you still have to be the number one person in your household. So time management is very, very important. I have to manage my professional life as well as my personal life so that there's a balance and everything gets done. For some people, that's very overwhelming, and I can understand why, because you're wearing multiple hats. You're trying to micromanage your kids' activities while take care of your in-laws, trying to have dinner ready, but still be a full-time working professional. One of the best things that I can recommend for that is to make sure, one, you are prepared to negotiate what you want in your life, okay? So sometimes we as women carry a lot of burden on our heads. One of the things that you have to do is divide your time appropriately. So when you're in your clinical hours, dedicate your time to clinical hours. If you have children, make sure that you have somebody who can manage them with you. For me, I had a nanny for 8 years, which is a privilege, but also was something quintessential so that I could work the type of hours that I work. Having a support network is very, very important, and you need to find your support group. So women, we thrive on being there for each other. So if it's friends, if it's a family, if it's siblings, you go ahead and make sure you utilize them. It takes a village to raise a family, and it's okay if you ask for help. Don't be shy about that. And that's something that I learned because, as a professional woman, you want to do everything. You want to take care of your children, you want to take care of your house, but you have to delegate tasks. And so delegate them, negotiate your life. You're going to work full time, fine, but then you're going to have somebody who is going to help you with the children, who's going to help you with your household, and ask for help when you need it. Entrepreneurship. So that's a big question that I always get. Like, how do you have time? You are running a private practice and you're consulting for big hospitals, but then you're also doing something entrepreneurial. Entrepreneurship, I feel, is this kind of itch that you get. It's deep inside you. You want to do something and you cannot get it out of your head. Now, most people have ideas dime a dozen. For you, if you have an idea that you're really passionate about, tell your story. Talk to somebody about it. That's the number one thing that I learned, is that if you have an idea and you're passionate about it, talk about it. Get to know what people think about your idea, and then do research on it. My research, basically, because I'm already a physician, so research is something that I'm really good at doing. I asked people, when you had an idea, how did you start it? How did you implement it? What were your pitfalls? What were some of the things that you learned on your way? And a lot of times, one of the biggest things that I learned was nobody, when they start something new, have any clue how to do it, which is so refreshing because you always think that these people who've made it knew what they were doing from the get-go. And one of the best podcasts that I can recommend for new up-and-coming entrepreneurs or founders is this podcast called How I Built This by Guy Raz, and that's on the NPR network.